Cholera is a disease related to filth and insanitary environment. Let me take you on some statistics. So it's a statistical journey now on cholera in the Greater Accra region of Ghana. Here we go. The region has recorded some 7,000 cases in the last 3 months, with over 50 deaths recorded so far. In 2007, only 7 cholera cases were recorded with no death. In 2008, the recorded cases had shot up to 823 with no death recorded. In 2009, however, there were 431 cases with 12 deaths. 2010 had 7 cases with no death. The current epidemic is similar to the one that struck the country in 2011, where over 9,000 cases were recorded with 72 deaths. In 2012, 7,000 cholera cases were recorded with 48 deaths. And in 2013, 22 cases were recorded with no death. I could take you to the Volta region, to other places, but we will stick to the Greater Accra region for today. My guest will tell us, because it's a Friday and it's our relationship Friday, but we want to relate it to what is relevant today, and that is cholera. So we're thinking in the family form. If you're married, husband, wife, children, if you have external relations with you, how can you protect yourself and prevent getting cholera? My guest is Madam Linda Vanuatu. She is the Greater Accra Regional Director of the Ghana Health Service. I want to say good morning to you, Dr. Vanuatu. Thank you for your time.
Thank you and good morning.
So we know that cholera is not friendly, but it can affect anybody if you don't keep your environment clean. Generally, give us the causes, even though we know that it's filth. How can you get it if you're in your home and your immediate environment is okay?
Well, good morning to the listeners, and I'm happy to be here to be talking about cholera because it's very important. Cholera is an acute disease. Acute meaning that it can happen suddenly and it can also end. And it's brought on when someone eats food or drinks water that is somehow contaminated with fecal matter or feces. Or if you get your hand into your mouth when you have feces on your hand, then you can get cholera. You cannot see the feces probably with your naked eye, because it may not be that you see the feces there and you've touched it and put your hand into your mouth. But the water can be infected, the food can be infected with the bacteria that causes cholera. So somebody who was well can suddenly start passing stools. And the cholera is associated with very watery stool. And the stools have been described as rice water. Okay. So if you know how rice water looks like, there's a lot of water. And that is exactly what happens to someone who gets cholera. So the feces that the person passes virtually drains the person of water that is within the body. And it's not just the water that is passing, but what we call salts, like potassium and the rest, are also lost through the feces, and they might be vomiting as well. So that is how cholera presents.
Okay. So if you have a case in your home, how do you handle it? If a child has it, or the mother or the father?
Okay. Immediately you realize that you are passing stool. If you have ORS with you, you can mix it with water as required by the sachet, and start drinking.
So let's just stay with ORS. There's the old one that we all know, but I went to the pharmacy recently, and there's a flavored one as well.
That's okay, because some people find it difficult taking the original one that was not flavored. But once it is written ORS, they give you how much water you have to mix it with. So you do that and you start drinking. But please don't stay at home, because you are losing so much water and you never know how it's going to end. You see, as we talk about cholera, we also have to remember that out of 100 people that may get the bacteria into them, 80% may not show that kind of cholera that will take you to the hospital. So you never know how yours will be like. So we suggest, and we strongly suggest, that as you start drinking the ORS, run to the hospital.
Okay.
If you have coconut with you, you can start drinking the coconut water also.
But in addition to the ORS?
Yes,
or?
because you need to replace the fluid, and it should be so much. Some people, unfortunately, get to the hospital dead. That's why we are emphasizing this point, that please don't stay at home. Some people go to the pharmacy shop to buy themselves ORS and say that they would wait and see what would happen. And unfortunately, it happens in the night. By the time they get to the hospital, they've lost so much fluid that they die within minutes, or they even die before they get to the hospital.
Okay, so you don't have immediate access to ORS, but there's a local mixture, salt,
and water,
sugar, and warm water. That works?
Not hot water.
Okay.
Yes, water that is boiled and cooled. So you can mix that, but please, because of the nature of the stool, you know, if you've seen a cholera bed, you realize that there's a hole in it to show you the volume of the feces that will come out and what is even used to receive it. So as you drink whatever you want to drink, even if it's mashed kinky that you have, that you add a lot of water and start drinking, please go to the hospital. But whatever it is, when it starts at home and you have access to anything like the ORS or coconut or mashed kinky, whatever, don't wait and say that I'm now going to prepare the rice water to drink. Even if it's rice water, you can drink it. But don't wait to say that I'm now going to look for it. For example, if you have to go and buy the ORS in the night, then why don't you go straight to the hospital? Maybe on your way to the hospital, you can buy the ORS, mix it, and then continue to the hospital. We want people to get to the hospital as quickly as possible.
So what is causing the rise in cases? Because we thought that by now it should be coming down.
Well, the rains haven't stopped. You know, when you look at the trend, you find that it usually starts with the rains. Sometimes we have 1 or 2 cases, but as soon as it starts raining, then we have it. Remember that it is when somebody has eaten food or drank water that is contaminated with feces. You look at the environment in Accra, and you find that a lot of people unfortunately defecate anyhow, anywhere. And when it starts raining, it goes into people's homes, it goes into drinking water sources, it goes into food that people sell in the markets, and people buy them. And because of the filth and the number of flies that we have around, you also have the flies settling on feces and then settling on food that is not covered. And also people buying the food, eating them, and then coming down with cholera. You also realize that there are a lot of people who sell food near gutters. Some of the gutters are so choked, some of them are full of all sorts of things, including these black plastic bags, which may contain feces. So you find that the fly has a very easy job to do. Just settle here and settle on the food. You look at the way people wash their hands when they are buying these food, because the one selling the wache or something else has just a bucket of water and a bowl, which everybody would use to wash their hands. And if it's something that they sell in plates that they have to wash, then you realize how they wash it and serve the next person. So the environment is very good for the cholera to spread. And the rains haven't stopped. Most people haven't changed their habits, and therefore it continues.
I mean, it's a shame. It's
big
really
one.
a shame that in
a big one
with today with all the technologies,
and in the city, the greater Accra
exactly
region,
we're recording these high numbers.
8,000.
We didn't even in 2010 and 2009, 2008. I mean, but the point is, once you leave home, maybe you can package food for the children, but usually the adults don't.
Right.
So you still have to rely on foods around you.
Right.
Where the person is selling could be clean, but you don't know the home where the food is coming from.
Right.
So how can you still eat food from outside and stay clear of
That's
cholera?
why we say that don't buy food that is cold. You see, you don't know where it's coming from. And I wish that those who sell food for people to buy would also take advantage and improve upon what they do. For example, they could have coal pots with them and be heating the food to make sure that if there's anything in it, it is killed. Because bacteria, viruses, all these things can be killed by fire. So if you have food that you sell to people to eat, I think it should be your concern as well that I would not sell anything that will let somebody fall sick. And as you leave the house, and as you rightly say, you may not be able to carry food. This morning I heard on radio, some people have now changed the way they do things. Now they try to take food to work.
I have as well.
Yes. And I would suggest that when you go to work, don't also wait till it is very cold before you eat it. So you can change a bit. Maybe at 10 o'clock you eat the food so that it doesn't stay till 2 when it is so cold. Unless you have a means of heating it. If you do, then you can do that. But if not, then I'll suggest that you try and do that. Second thing is the water. You know, our work has shown us that even the sachet water can bring you cholera.
The one we call pure water.
Yes, it's
may
pure.
not be pure after all.
Yes, and even the people who are selling it. When you go on the street, you find that somebody picks it for you, and most invariably, people hold it, and the one who is going to drink also bites the same place that the person held to give to him or her. So that can also transmit, because as people walk around town, they would not wash their hands as they sell. So it's up to you as the individual to make sure that you don't get the bacteria into you. It's very important. Right.
It's this is the common little basic things that we do every day. That is what brings the cholera. Because as you were talking about, if you go and buy food and you have to wash your hands, you're using one cup that everybody else has used and would use after you. And so you're using the hand to fetch the water. Somebody else will come and use it. You may not know. You can use your right hand, and that kind of thing is the everyday thing that we do.
And even then, you see, when you go to eat, you find that people are going to eat fufu or banku or something. They bring them this small bowl of water, and they put their hands in to wash. Now, the same hand that you are washing, you've washed the water into this, and it's the same water that you finally move your hand out of to eat. We would suggest that if you go to eat in a place, don't take that bowl of water. Let them pour the water onto your hand. Your hand must be washed with soap and under running water. It doesn't mean a tap flowing. You can fetch the water and pour onto your hand. You can also have what we call the Veronica bucket. That is a bucket that has a tap, which you can turn on. So you still have your hand washed under running water.
You know, I was surprised to hear some people drank cocoa and then got themselves infected.
Yes.
How? Because cocoa is always served hot.
You see, some people buy it in plastics. The ones selling may not have washed. There are so many ways. All you need is a little bit of feces that has the cholera to touch something that is going into you.
That's it.
And this person may have bought the porridge. You don't know, maybe he bought it when the porridge was almost finished. When it comes fresh, that one is very hot. But as the day goes on, you find that it becomes cold. Or the person bought it and did not take it immediately. Don't you get surprised that you put food down, you think it's okay. If you don't do anything to it, you find that maggots start coming. Where did they come from? That's why we have to make sure that the food we are eating is very hot. Not hot that will burn your mouth, but at least if it is hot, you keep it for a while, and when you can eat it, you do. You see, the children, when we were in medical school, we were taught that children below a certain age did not get cholera. But now you find that people are on vacation, they are roaming around, they can get to a rubbish dump and see something that is attractive and they will go there. So we still have to be careful about our children. When the children come back from town, wherever, even as adults, as soon as you get home, wash your hands. Before you take off your clothes, before you do anything, because you never know, you may have touched something that somebody else has touched. People sit in cars, go home, and they get it. So everybody
People
has
touch
to
the stairs when they are climbing it. You know, anything.
Anything.
Wow. Are we supposed to be frightened by the figures?
No, I think that we just have to be alert and be aware that it is something that is still ongoing. As at now, to give you an idea, we're still recording about 200 to 300 cases per day in the Greater Accra region. Now, when you look outside, you realize it may rain, and if it does, then again we are in trouble, because the rains 2 days ago was quite heavy, and that means that still it may wash things out. And once we are still getting cases, it means that it is still on, and everybody has to be part of the fight.
When should we expect the figures to start coming down?
We were hoping that it would have come down by now, but our records indicate that they are still ongoing. One of the things is that those who bring patients also come back as patients, and that is also a source of worry for us. We are educating people, going into the community, but still people probably are not doing what they have to do. And again, because they live in the same place with that person who initially fell sick, it's likely that whatever made that person sick is still there and making them sick as well. Access to toilet, access to good drinking water. And if you are staying in a place that doesn't have it and you go back there, people have different constitutions. So although both of us may be infected, mine may start earlier or yours may start earlier, but we are still in the same environment. What we would wish is that when you take somebody to the hospital and you are living in the same house or the same environment with the person, then you have to be aware that you have to take extra precaution to prevent yourself. And as soon as you start having the diarrhea, go to the nearest hospital.
I hear we also have cases of reinfection. So people who have had cholera healed and then they get it again.
Yes, we have had some where the person, some of them came, they said they ate, for example, wache, came, got well by God's grace, went home, and then went back to buy food from either the same place or somewhere else. And it showed that wherever the person bought the food from was close to a public toilet. So this person went back. There are others who have also gone home and gone back. So it means that the education has to continue for people to know exactly what to do. Simple things like wash your hands with soap and under running water. Don't eat food that is not protected, covered. Don't eat food that is cold. And as soon as you got the diarrhea, move to the nearest hospital. I must say here that I know some of our facilities are overwhelmed because we don't have huge...
And then Adabraka yesterday, you know, in our news.
Yeah, and then Kaneshi. We don't have huge places to receive cholera cases, but we have now informed them no one should be turned away. Some of them...
But by them sitting, because yesterday I was watching with Roland the Adabraka situation where people were seated because they didn't have enough beds for them to be lying down. Ideally, they said when you are dehydrated like that, you should be lying down instead. But by sitting close to each other, would they not be reinfecting each other in the process?
No. Okay. Because now they are there anyway, and we are treated. It is when they are getting better that they can now be careful. But as they are there now, it is the responsibility of the health sector to make sure that the people who are there get well. The main thing we are trying to do when they come is to rehydrate them.
Okay.
To replace the fluid that they have lost.
So the Kolebu Polyclinic will now not be turning people away, because I think one of their complaints was that the place was choked. I mean,
everywhere is choked, and that is why we are appealing to Kolebu, to wherever that if you send that person away, it is not like there's one hospital that has like 300 beds only for cholera. There's none. So if you send somebody away, the next place is also choked. So we just plead that people should meet them, give them the rehydration that they need, continue with ORS if they have to, observe them till they are well enough to go home.
Is the treatment still absolutely free? You don't pay anything?
That's where the catch is. We have the infusions for free, but it becomes a challenge when they have to give the cannula and the giving sets. For us as the health sector,
that will be in ordinary terms the drip?
The drip is the fluid, but the needle, if you like, and what the drip passes through, the infusion passes through, that's it, yes. And for the even for the private sector, one of the things we have said with our facilities is to make sure that they give them the infusions.
For free?
Yes, the infusions that are given for the treatment of cholera, those ones are for free. And we have asked them to do that. Because of the huge numbers that are coming, it becomes a challenge, but we continue to replenish, and if we run out, we buy to replace. And that's a very good question, because now, apart from talking about the human life, unfortunately, we have lost some. The time that you as an individual will lose in doing your business, we are also spending money with infusions, with the giving sets, and with the needle, if you like. All that put together is a lot.
Does the service has enough money to battle this cholera? Now it's an epidemic.
Yes, it is. Therefore, whether we have money or we don't, we will. But we need money to do this. You see, there's a need for our disease control officers, our public health nurses, the community health nurses, to move into the communities, to continue with the public education. That takes money.
Where's the money coming from?
For now, we expect people to do that. The money is now coming from us as the health sector. Yes, but we expect, because there's more that needs to be done. In fact, managing this outbreak would need a lot of money, because it's not just about those who are coming, but those who are in the community who have not yet come, and we hope they don't. We need to get to them to let them know, and to move every day into the community to educate the public as to what to do entails money.
So we need money, 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 money.
We do.
All right. Dr. Linda Vanutu, I want to say thank you so much for your time this morning. So Dr. Linda Vanutu telling us more about cholera. And if you hear the statistics and the things that make us or gets us closer, attract us to the disease, you know, the everyday things that we can do away with. Wash your hands with soap under running water. You know, all the little basic things. Let's just keep ourselves clean, and that's it. Stay clear of cholera.